Hi guys. So one of the chapters I chose to review was chapter 5, the self of the therapist, being aware, prepared, and ethical. As you could tell from the title of the chapter, this chapter teaches about the importance of being self-aware as a therapist. I feel it kind of humanizes us as therapists to show that we are people who deal with our own personal issues and challenges in life. The introduction of the chapter does talk about how all therapists are known as wounded healers. What this definition means is that therapists are professionals who are helping others while enduring their own severe challenges in their personal lives. The purpose of this chapter is to help us understand and acknowledge that it's okay for us to be humans, but it's important to take care of ourselves so that our clinical work will not be jeopardized. The chapter has 6 topics. The first topics is clinical opportunities and challenges. Being a therapist, we have the opportunity to help people grow, change, and improve themselves through therapy, which is very meaningful work for our clients and everyone around them, like their families or partners. We as therapists have the front row seat in seeing our clients' symptoms transform from being depressed to being happy, from being suicidal to discovering there's a reason to live with a purpose, and helping trauma survivors find their strength. In general, we get to see our clients transform to their higher self. However, though, the challenges in being a therapist is that it is one of the most stressful professions in the world, along with police officers, firefighters, and even bomb squad units. Being a therapist requires deep level of emotional investment and a higher level of stress that comes with working with people who experience many mental and relational health challenges. The book provides the top common stressors that mental health practitioners endure, such as countertransference, secondary trauma, personal losses, problems with collecting fees, and conflict with coworkers. So on page 83 in our book, there are some facts about what therapists endure in their career. 73% of psychologist trainees reported clinically significant levels of stress. In a sample of practicing clinicians, roughly 1/3 had experienced anxiety or depression, whereas more than 40% reported emotional exhaustion in the past year. Suicidal ideation has been reported in 29% of mental health professionals, and almost 4% admitted they had at least one suicide attempt during their professional life. I know these facts may sound scary and even overwhelming, but this is why it becomes important to become self-aware and acknowledge when you're starting to feel overwhelmed. So, ignoring or denying our own work stress is dangerous and unhealthy for the therapist and the clients. Therapists that are overwhelmed with their own distress, depression, anxiety, or suicidal ideations are not ethically sound position to provide treatment to others facing similar struggles. Of course, we experience stressors in life and our career, but if we are feeling overwhelmed with our thoughts and emotions, this can cause us to be less focused on our clients than usual, and we will be less likely to provide our highest form of care. So the next topic is compassion fatigue and burnout. On page 84, compassion fatigue is described as a state experienced by therapists categorized by a preoccupation with the suffering of those being helped that may result in secondary traumatic stress for the therapist. Compassion fatigue makes it more difficult for therapists to experience empathy for a client, resulting in the therapist in creating a protective wall. The wall acts as a shield for the therapist to protect them from the pain and suffering of their clients. However, this causes a lack of empathy, which can ruin therapeutic alliances. It diminishes the quality of therapy services provided, and it leaves nothing to give to the client. So the book does provide examples of what increases the risk of experiencing compassion fatigue. For example, a therapist who works with caseloads revolving around extreme trauma, such as working with sexual trauma survivors. Another example is therapists who have their own history of trauma and are more likely to develop compassion fatigue. We need to be aware of the symptoms that come with compassion fatigue so that we're able to distinguish it when the process is affecting us. Symptoms range from chronic physical and emotional exhaustion, depersonalization, irritability, negative feelings towards work or even others, low job satisfaction, headaches, and even weight loss. So now with burnout, it's described on page 86 as a high degree of emotional exhaustion, minimized sense of personal accomplishment from work, and may involve increased apathy and distrust for clients. So the physical and emotional symptoms of burnout are chronic fatigue, stomach problems, insomnia, headaches, hypertension, feelings of hopelessness, boredom, anxiety, and withdrawal. So by becoming familiar with these symptoms, we as therapists can recognize it in ourselves or even with our own colleagues to help each other acknowledge compassion fatigue and burnout. So how does a therapist overcome compassion fatigue and burnout? By attending therapy. So the next section, as you can probably tell, is covering therapists attending therapy. So believe it or not, there are several reasons why therapists do not seek their own therapy. One reason being due to refusing to admit they are stressed, the stigma of seeking therapy, having a full schedule that makes it difficult to see clients. So therapists who actually pursue their own therapy experience more personal growth. It creates positive life changes. They feel less burnt out, and they actually prevent unethical behavior. So therapists need to seek out professional help in response to their own individual and relational problems that may impact their work. Several mental health professional code of ethics indicate that a therapist must seek appropriate professional help for personal issues that may affect their clinical work. It's actually considered unethical for a therapist with their own mental health issues to continue to provide therapy without receiving treatment to overcome these challenges. In addition, it may also be helpful to speak to like a colleague or even a supervisor about having these personal stressors rise. So the next topic is self-care, which is defined on page 88 as the deliberate behaviors a therapist engages in to maintain a high-functioning self capable of providing valuable and effective clinical services to client. So self-care is correlated with preventing ethical violations from occurring, improve clinical outcomes, improve therapist capability to focus on what is best for the clients, and enhance personal lives. Research has shown that the more self-care a therapist engages in, the better quality of life the therapist has. Examples of self-care activities consist of spending time with one's partner or family, maintaining a balance between one's personal life and professional life, and maintaining a sense of humor. I think that explains why a lot of our professors in our program have a great sense of humor. So, ideas for prevention and treatment of a burnout include engaging, in physical exercise, eating a proper diet, taking regular vacations, seeking therapy, setting limits, and just separating work and private life. The book does say the most helpful activities are the ones that help a therapist slow down their thinking, focus on the present moment, relax, and regain confidence and gain new clinical skills. So I like reading this section because it said that we should be using the same theory, the same research, and clinical techniques to help care for ourselves that we tell our clients to do. So me personally, I find myself doing the same coping techniques that I teach my clients to do for themselves. So the next topic is therapist and client values. Difference of values and beliefs between the therapist and client can be challenging, and it's the challenging part to therapy. A few examples the book provides of values colliding would be like a therapist who comes from a religious background that is working with a client who is a lesbian, a feminist therapist whose client is a sexist. The values of therapist and client strongly influence the course of therapy. So on page 90, they say that moral values refer to basic beliefs regarding what an individual, group, or society considers good and right. They represent basically the standards of appropriate behavior. So therapists may find themselves with clients of differing values. Both therapist and client may even become aware of these values clashing. So as therapists, we shouldn't push our values onto our clients. The book gave a good example of how we can address or handle value differences using our theories. For example, the book provided how we can use narrative therapy to guide ourselves in helping the clients explore the values in a non-judgmental way, deconstructing where their values come from. Like, did they get these values from messages from family, the media, or from their culture? And then allowing the client to decide what they choose to believe and value, and helping them follow their own path. The therapist respects this chosen path. Excuse me, I was about to sneeze. So anyways, while addressing any potential obstacles of what that belief is and helping clients live according to their own values and beliefs. Excuse me. In some cases, this may be challenging for therapists, and this is why supervision is helpful, because we can learn how to handle these certain value differences. So the final topic is developing and maintaining competence. Therapeutic competence is defined on page 93 as therapists' ability to promote positive client change. We become competent by obtaining the best education and clinical training. Through our training programs, we develop a primary level of expertise, with our theories, clinical skills, the process and change, and human development. This training is important for providing the framework from which the therapist will practice. As therapists, we are ethically responsible for our client. We need to ensure we are performing the best work possible for our client, while ensuring we are maintaining therapeutic competence and developing strong clinical skills. What this also means is making sure we're staying up to date with current research, overall just developing new skills and advancing our education. It never really stops. So that's basically the summary of chapter 5. I felt like it had a lot of helpful information. Just like I said, just taking a step back to realize that we're human as well, but also taking that responsibility in ensuring we basically, sort out through our own personal life and challenges, so that way it doesn't interfere with our clinical work, so we don't accidentally perform unethically, we don't impact our client negatively. So I thought it was a really helpful chapter. So thank you for watching.